Welcome. I want to officially get started. I am so glad that you're here. Well, first of all, my name is Dr. Alissa Wolfe. If you don't know me, if we haven't spoken yet, if you don't know much about me, I specialize in complex and persistent pain. And I'm here today to show you and to share some of the latest science and some practical strategies that are actually working for people with persistent pain, with complex pain, helping them find real relief. Now, what I want to say, number one, and hopefully this is already pretty obvious, but number one, this is actually live. Like I'm actually recording this live, which I know is rare to attend live workshops these days, where it's actually live. Like this is not a pre-recorded session made to look like it's live. Hello, Vincent. Tuning from Tennessee, full left side body CRPS for 10 years. We have spoken over the phone before. Awesome. Vincent, yes. Okay. Um, anyway, and welcome. There's a lot of folks here with CRPS. So this talk specifically was not geared specifically for CRPS, but everything I'm about to tell you and talk about does apply to CRPS. But I may not be referencing CRPS specifically because it doesn't only apply to folks with CRPS because some other people can still benefit from the same education and also the same strategies. So anyway, like as I was saying, this is really, really live. If you don't believe me, feel free to type into the chat, say something in the chat, like let me know your name, where you're from, and a little bit about the pain that you're struggling with. And because this is live, you can drop your questions in the chat as we go. So I will do my best to try to answer them as they come up. Sometimes I just get on a roll and I don't want to lose my train of thought. So if I don't get to it right away, I'll save some time at the end. We'll answer your questions at the very end. I'll scroll back through the chat and find all your questions. Sound good? That being said, the chat box is not just for your questions. I do want you to get really comfortable using the chat box throughout this presentation because honestly, it can feel really weird, lonely, isolating. I don't know. It feels like speaking into a screen with zero interaction. It's like speaking into a void. And so please interact with me. Let's make this a conversation, not just a lecture. Hello, Mateo from Florida, CRPS plus 2 year or 2+ years. Yes, so we do have a lot of CRPS folks here today. Also, maybe one more little bit of housekeeping. If you could do me a favor, do yourself a favor and just close the other browser tabs that are open, both literally, figuratively. We're going to cover some pretty important information today, so let's minimize some of those distractions. Give yourself permission to absorb the information. Give yourself permission to be fully present for the next, I don't know how long this one's going to take, maybe an hour. It might be less than an hour. Um, and also grab something to take notes with. Um, uh, who are my note takers? Like, are there note takers here? Because I am totally a note taker. I'm a huge note taker. I write everything down. Sabrina, yes. If I want you to grab a pen and something to take notes with. Now, you may have gotten emails from me about a workbook that you could print out and you could take notes on that. If you did print that out, amazing. You get 10 arbitrary points that don't matter because you're awesome. But also, I have bad news. I kind of decided last minute to change it up everything and go in a different, not in a different direction, but just I basically decided to redo the entire thing like yesterday. So the workbook, you can take notes on the opposite side, on the blank side, all right? And that will be lovely. Now, there is a lot of information available these days about pain, pain science, how to manage pain. There's a lot of different information. And so I want to be clear that this workshop is not about fixing your posture or core work or finding the perfect exercise. This is not about regulating your nervous system or eliminating stress. This is not about convincing you or you're convincing yourself that your pain is just your thoughts and that you can fix your pain by manipulating your thoughts. And this is not about blaming your mindset, your emotions, or your past. Okay. Maybe you've been told to just think more positively, or that you can just calm down. If you could just calm down your nervous system, then your pain would go away. Or that you just have a weak core, or you have bad posture, or whatever. Okay, that's not what this workshop is about. What we are going to talk about is how pain systems adapt over time and how that adaptation changes the rules of recovery. Sound good? Yes? Okay. Again, if you're just tuning in, if you haven't already, let me know in the chat what type of pain you have. Okay, maybe it's widespread back pain, maybe it is CRPS, maybe it's shoulder blade, headaches, pelvic pain. Let me know if you haven't already what type of pain you have and possibly how long you've had it. We already know that we have quite a few folks here with CRPS. Oh, functional neurologic disorder. So widespread pain, fibromyalgia. So it moves around. Gotcha. Okay. Anybody else? If not, that's okay. Both knees. OA. Okay. Good. So we have a variety. So whatever it is, most people who find their way here, pain has been a part of their life for months or years. We have low back pain and scoliosis. Yep. Um, and this isn't their first attempt at finding relief. Most people have tried everything. They've done physical therapy, they've done medications, maybe they've done injections, maybe surgery, sometimes mind-body methods. Catherine says pelvic pain. Yes. Um, and most people don't want to just cope better with pain. Obviously, yes, we can always cope better with pain, but they don't want to just cope better with pain. They don't want platitudes. They don't want a pep talk. They want actual symptom reduction. They want to feel better. And they're looking for evidence-based options that they can use alongside their medical care. So we're not trying to abandon medical care, but some other additional strategies that we can use. Tammy says, been through 13 specialists. RJ says, surgical nerve damage in the right hand, 19 years. Oof. Um, yeah. Um, Evidence-based strategies. So yeah, if you're here, I'm assuming that you want to know what your options are and make sure that you're doing everything in your power to get better, right? So if that sounds like you, then yes, you are in the right place. Just briefly, if this is our first time meeting, if you don't know me yet, hello, my name is Alissa. I am a mom, which is weird to say. It still hasn't like, I'm a mom. I have a 5-year-old named Cooper and a 1-year-old. She's almost 2. She's technically 20 months old. This is Kennedy. Um, and I have fun fact about me. I have lived in a total of 6 states across the US. And in all of the coasts. So East Coast, West Coast, Hawaii, and also the Midwest. So I've got all the areas covered, I think. Amy says RA, lower lumbar back, bilateral, radiculopathy lumbar, and down both legs, scar tissue damage, migraines. Boy, Amy, got it all going on. Okay, and also I am a board certified orthopedic doctor of physical therapy. But despite my training in orthopedics, I actually do specialize in complex and persistent pain. I've been doing this for over a decade. I've been creating pain programs across the US since 2016, including one for the US Army. I founded my current program, which is called the Chronic Pain Breakup Method, in 2021, which now has helped hundreds of people with a wide range of pain conditions and that didn't respond to conventional treatment methods. And so the reason I'm here teaching this workshop, the reason that I work with clients online is because I have seen too many people get passed around the medical system with no answers and with nowhere to turn. Okay. I'm tired of it because I know that there's more out there than what the medical system has to offer. I realized all this early in my career. So I realized, and like I said, I was a physical therapist. I realized that doing the same exercises, doing the same kind of core work and stretches over and over wasn't the answer for everyone. Yes, it works for a good chunk of people, but it does not work for everyone. And so I was questioning why initially, and I dove into the research. And what I learned changed everything. Okay. And I started applying these different techniques that I read about in the research studies, I read about in the journals and the textbooks, but I never had seen them done in real life in the clinic. And so I started doing this, not really knowing what I was doing at the time, but I learned a lot along the way and I was blown away by the results. Okay. And we'll get to that later. Today, I exclusively work with people who have complex and persistent pain. Um, and this work has taught me that when we stop relying on the outdated traditional approaches that haven't worked, and we step out of our comfort zones of what we're familiar with, and we start looking at what's actually driving the pain rather than just managing symptoms, people get better. People with chronic pain, complex pain, persistent pain can get better in ways that we didn't think possible. Okay. So before we go any further, maybe you've attended workshops before that turn out to be just this like one big long sales pitch. And I personally have attended some of those workshops myself. And so I don't want to bait and switch you. I believe in transparency. I believe you deserve transparency. So I'm just going to say this up front. Yes, I do have a program. Yes, I would love the opportunity to work with you one day. But today, I want you to walk away with valuable information, with clarity, with direction, and understanding that will actually be valuable to you, whether you work with me or not. Okay. And at the end of this workshop, if you'd like to stay and hear a little bit about my program, you can stick around and you can learn about an opportunity where you can have a free conversation with me. But if you need to leave, you don't have to stay for that part. No hard feelings. Okay, fair enough. Yes, ma'am. Yes, ma'am. I'm teaching my daughter to say yes, ma'am, so I'm saying that to y'all. Oh, goodness. I'm so programmed. Amazing. Thank you guys. Um, sorry, I went ahead one slide. Whoop. Now, there is one thing that you should take away from today is this. So note takers, get ready. Okay, now's the time to take notes. Key number one, our bodies are adaptive. Okay, our bodies are adaptive. Your body adapts to everything. Okay. If you go to the gym and you lift weights, your muscles adapt, you get stronger. If you move to a higher altitude, your body adapts, it starts producing more red blood cells. If you spend a lot of time in the sun, your skin adapts, it starts producing more melanin to protect you. So your pain system is no different. Your nervous system is constantly learning from what it experiences and adjusting its responses to keep you safe. Okay. So, for example, when you experience an injury, the pain system adapts. All right. So, I was a volleyball player long time ago now, but I sprained my ankle probably hundreds of times. And so, for example, when I sprain my ankle, my pain system will adapt to protect me. My body will adapt to make my pain sharper. It will make my pain more noticeable, more sensitive. And it does this on purpose for my protection, to get my attention, to slow me down while healing happens, right? And in most cases, as that injury heals, the pain system quiets back down. It normalizes. Okay, the volume dial turns back down. That's how it's supposed to work. But, and this is very important, the sensitivity of the pain system doesn't always follow injury status. Okay, I'll say that again. The sensitivity of the pain system does not always follow injury status. Okay, injury is one input, but it's not the only input. Okay, these adaptations, they can happen with or without an active injury. They can turn up the volume on pain, amplifying signals, amplifying sensitivity. Now, inevitably, every time I share this information, someone will take this to mean that it's all in your head, that I'm saying it's all in your head. Okay. So let me be clear. This is not an issue of it's all in your head. This is not an issue of you being weak-minded or too sensitive. Okay. What I'm talking about here are real neurologic adaptations, okay? Changes in how your body processes information and how your body detects information. These are changes that everyone's body is capable of making. Everybody. It's not like, oh, like only a special group of people go through these adaptations. Everyone can go through these adaptations. Like I said, when I sprained my ankle goes through these adaptations. So now some people are certainly more prone to it than others, but this is what happens. Okay. Of course, I don't know why my video there. It's supposed to be a video. It's not playing, but whatever. Maybe none of the videos I have will play. Oh well. But we know this happens. Okay, this is what happens in cases of persistent pain, regardless of the diagnosis. So as I was saying very at the very beginning, yes, there are going to be a lot of people with CRPS here, but your diagnosis, I don't want to say it doesn't matter, but this happens regardless of the diagnosis. Okay. People ask me this all the time, Alissa, well, what about fibromyalgia? Alissa, what about chronic back pain? What about EDS? What about CRPS? What about RA? What about OA? Yes, the pain system hypersensitivity plays a role in all of those conditions. Okay. And I'll just say that CRPS is probably the clearest example of those neurologic adaptations taken to an extreme. But the same mechanisms show up across the spectrum of different pain conditions, persistent pain conditions. Okay. Now, people are really funny about labels and diagnosing things. We like things to fit into cookie cutter, tidy, little neat little boxes. But I'm going to challenge you to make a big shift and ditch this black or white way of thinking, because this isn't the kind of thing where you either have it or you don't. Okay. This isn't the kind of thing where if your symptoms match a certain set of criteria, then you have hypersensitive pain pathways. Okay. The sensitivity of the pain system exists on a spectrum. All right. I'll say that again because that's very important. This pain system sensitivity exists on a spectrum, and your position on that spectrum can change. The degree of sensitivity can change over time in both directions. It can adapt to become more protective, but it can normalize. And this is why your diagnosis alone doesn't tell the whole story. Okay, two people with the same diagnosis, the same MRI, even the same surgery, can have completely different experiences because they can be at completely different points on that spectrum. And both can improve with an approach that helps normalize those protective adaptations, those protective adaptive changes, right? Now, you may have heard it framed as this, as your system is just stuck in fight or flight. Has anyone heard it framed this way? That your system is just stuck in CRPS? Yeah, Sabrina. Amy says, yep. Okay. Or that, you just need to calm your nervous system down and that's going to help you, right? And so Tammy says, yep. So thank you, Vincent, yes. So while there's some truth to this, okay, that explanation oversimplifies what's actually happening. Yes, your body is in a protective state, but it's not that simple. There are deeper adaptations happening in the pain system itself, all of which are what's actually driving that protective fight or flight response. Okay, so let me give you some examples of what I mean. So I have four. Oh, look, the video did work. Fantastic. So 4 examples of 4 different neurologic adaptations, just to give you some examples of what the heck am I talking about, okay? Number 1, peripheral nerves can change. Okay, so the nerves in your body adapt almost like, and they become more responsive. They become almost like super detectors. They shift their physiology. They can start firing in response to smaller and smaller inputs to where they can become triggered by normal pressure, by small movements, by small like stretches, even light touch, even air movement or temperature changes. They can become so sensitive that they can start firing in response to these things that are normal or neutral stimuli. These are things that right, should feel normal or neutral. Okay. So that's the first one. The second one is so basically what happens is those sensitive nerves will pass a high volume of signals up to the spinal cord. Okay. And normally the spinal cord acts like a dam. So that's a dam. I don't know if y'all can tell. And then, so then the dam or the spinal cord would only pass messages up to the brain in a very controlled way. So most of the signals get stopped right there at the spinal cord level. And only the most important messages make it through up to the brain. But when this adaptation happens, with those hypersensitive nerves, it's like a massive downpour happens and the dam can't regulate the flow anymore. And suddenly everything rushes through. So normal signals rush through, neutral signals, danger signals, they're all flooding up to the brain, which is why in a lot of cases pain can feel so out of proportion. So that's number two. Number three is those messages, okay, those messages make their way up to the thalamus and the sensory cortex. Those are structures in the brain. And the brain, those brain structures start getting flooded with information, and it's hard to keep up. Okay. It's unclear what those signals actually mean. And in other words, there's almost like a disconnect between what your body is detecting and what your brain can actually interpret. The communication becomes less precise. Sensory processing becomes less precise. And when information is unclear, the system defaults to protection mode. It activates the alarm just in case. It activates its protective responses just in case. Now, this is why things like immobilization, avoiding movement, and disconnecting or disassociating from or dissociating from your body can actually make this worse. And this is why we don't recommend those things because it deepens that disconnect. Okay. So that's the third thing. Number four, the fourth example, what happens is over time, this starts to wire in like a warped form of muscle memory. So the pain pathways strengthen the more that they're rehearsed. And the more often pain occurs with a specific activity, the more automatic that response becomes. Okay, so for example, if your pain spikes every time you go to do the dishes, it starts programming an automatic pain response. So anytime you do the dishes, the brain just starts kicking that response in automatically. This is also why pushing through pain is not recommended because it only rehearses this more. It's like practicing a bad habit. We don't want to reinforce the bad habit and strengthen these associations, these automatic patterns, right? So those are four examples. These are four neurologic adaptations that we know occur, quite common, okay? And these four adaptations, they work together. It's like a cascade, okay? So it's not like, oh, I only have one of these. Like you probably have all of them, okay? And the result of these neurologic adaptations are pain and a whole cascade of protective responses, okay? So, how do you know if you have this going on? Well, let me ask you a question. Like, let me ask you some questions, right? Is your pain unpredictable or inconsistent, right? So like one day, you can walk 3 blocks just fine, and other days the same walk is just unbearable, right? Do you ever wonder why that is? Yeah. Does your pain travel or spread? Has it become more widespread? Yes. Do you have strange sensations like burning or buzzing or vibrating or creepy crawlies or heaviness or swelling for no reason? And it's like when you try to describe this to somebody, they look at you like you're crazy. Yes. Okay. You're not crazy. Your pain system's probably hypersensitive. And I don't know, maybe you have the same issue as you have a lot of tension or tightness, muscle tightness. And no matter how much rolling or stretching or releasing you do, nothing seems to release that tension, right? Is your gut a mess, right? Do your hormones feel like they're out of whack? Do you have no libido? If you have periods, are they a mess? Yeah. Do you have headaches? Okay, that's what happens when you have these pain pathways that become sensitive. Your sleep is crap, your memory is shot, your executive function is gone. Okay, you feel sore, you feel anxious, you feel on edge all the time. Okay, all of these things are not a coincidence. This is not a coincidence. These symptoms are not separate problems to be treated individually. They're all connected to what's happening in those pain pathways. Okay, it's not inflammation. Okay, you may have high levels of inflammation, but if it were just inflammation, the anti-inflammatory medications would work, the creams, the injections would work. Okay, do you ever wonder why maybe you might have so much inflammation? This could be why. It's part of that protective response. Okay, and it's not coming from nowhere. And I'll say this, it's not your diet, not necessarily your diet, although eating better is great. I think you should eat better, of course, but it's not going to change those pain pathways. And it's not just stress or anxiety or trauma. Okay. Yes, of course, we know that stress influences pain for a lot of folks. But for a lot of folks, you're anxious because of the pain. Anxiety is a part of this protective response. So it's normal to have that, as part of this. Um, Repetitive, and I will say this, repetitive stress, trauma, uncertainty, even the frustration of repetitive failed treatments over and over. Heather, I'm going to save your question till the end if that's okay. Um, all of those things. So let me say that again. Repetitive stress, trauma, repeated failed treatments, uncertainty, those things can turn up the volume on the sensitivity level. But removing them alone doesn't reverse the condition. It won't normalize these neurologic adaptations. Okay, so we have to address these neurologic adaptations themselves. Now, many people, when they hear this information, they feel a mixture of things. They'll feel a little bit of hope and then probably a lot of doubt because I would call it cautiously optimistic. Okay. Because when you've had pain for really any length of time and you've already tried a lot, you've heard a lot, over time, what happens is that the fear of disappointment becomes greater than the fear of trying something new. And so you've gotten your hopes up before, you've invested time, money, energy, hope into different treatments that promised relief, and then they didn't work. And so now when you hear about another approach, your first thought is often, oh, here we go again, right? And that reaction makes complete sense. The skepticism is valid. So I'm not asking you to get rid of the skepticism. All I'm asking is that you stay open for the next few minutes so that you can see what the path forward could look like for you. Fair enough? Heather instantly triggered. I'm so sorry. Sorry to even bring it up. I know it's so real. Um, so this is the real reason why nothing has ever worked. I did not target you, Heather. Oh, anyway, this is the reason why nothing has ever worked because most care is built around either managing pain or managing stress. Does anyone notice this too? Right? Like, why is this the focus? Okay. On one hand, we have the traditional medical approaches. Oh no. See, there's a typo. I told you guys I did this like today. So this should say medical, like medications and modalities, not physical approaches. So just for the record, we're all on the same page, okay? So on one hand, we have the traditional medical approaches, things like medications, nerve blocks, injections, TENS units, all these things. And the focus is on managing the symptom of pain and reducing pain intensity, which, to be clear, it is important. Okay, it has its place. It has an important role to play. But these approaches, aside from many unwanted side effects, don't address the underlying causes of those symptoms. And you all know this, right? Um, and so we can kind of think of these like medical approaches, like think of it like this, like if imagine listening to the radio turned up way too loud, and it's so loud where you can't think straight. Okay. You could put in earplugs, but that won't change the volume setting itself, which is why with these treatments, relief is only temporary. Now, on the other hand, we have treatments that focus on structure, psychology, and stress. So now we have the actual physical approaches here. This title is correct, okay? With physical approaches, okay, these are things like physical therapy, chiropractic care, surgery, losing weight, using braces or orthotics, for example, all of these things, right? These things focus on structural and mechanical factors. And of course, don't get me wrong, those things matter. When you have pain, strength, alignment, range of motion, we need to address that. But what often happens is that people can't make meaningful progress with things like strength and range of motion until the volume on those hypersensitive pain pathways comes down first. Because you can't tolerate the exercises without pushing through and it flaring symptoms up. But once sensitivity is reduced, if we can turn that volume dial down first, the body starts fighting back with this overactive protective response. And then finally, the exercises that never worked before will suddenly be more effective. Okay. So we have physical approaches. We also have cognitive approaches. So there are cognitive approaches to pain where the focus is on thoughts, beliefs, emotions, things like that. And this is the focus with things like pain reprocessing therapy, cognitive reframing, journaling, emotional processing, mindfulness, distraction therapy, hypnotherapy. Maybe you've heard of, type yes in the chat if you've heard of being told to send your brain safety messages, or convince yourself that you're safe, or try to view pain as a neutral sensation. Tapping, Sabrina, actually falls into the next category. Yeah. So, but maybe you're familiar with like the work of John Sarno, Alan Gordon, Howard Schubner, Nicole Sachs, Dan Buglio, all of this. Okay. So these, let me just say this before I get there. Many people do find value in these approaches because your thoughts and your beliefs absolutely influence your pain. And how you respond to pain matters cognitively, emotionally. How you respond matters. And so these more cognitive approaches can reduce fear. They can reduce anxiety. They can reduce spiraling if you get yourself into that. They can help you cope better and they can prevent pain from escalating, which all of that is important. All of that is valuable. But changing your thoughts alone doesn't reverse these neurologic adaptations. Okay, I am all in favor of thinking positive, but solely using a mind over matter approach often falls short when we have this additional factor going on. Okay, so then finally, there are nervous system regulation approaches, okay, where the focus is on regulating your stress responses. The focus is on shifting your body out of that fight or flight state and into a state of rest and digest. So somatic practices, meditation, breath work, grounding, tapping, EFT tapping, vagus nerve activation. Okay. Doing these types of techniques might make you feel better after. Okay. You might even feel less pain, but you're more likely, you're definitely, supposed to feel more calm. And all of that is great. But when the sole focus is on the fight or flight response, we miss what's actually driving that protective response and we miss the opportunity to go deeper. So these approaches are not wrong, they're not bad, and they're not ineffective. They're just not sufficient on their own for addressing a hypersensitive pain system. So if these are all the tools that you've been given, right? Medications to mask your symptoms, exercises to fix the structures and the mechanics of things, therapy to change your thoughts, practices to calm your nervous system, then it's no wonder that you might still be stuck. None of these things address the neurologic adaptations that we talked about. And what I've noticed is that, and I don't know if you've noticed this too, but a lot of the advice that we get is very polarizing, telling you that there's only one root cause and you have to address that one root cause and you have to find only one key effective solution to the root cause. It can be multiple factors contributing, right? But when we have that sort of polarizing view on things, it sounds like a lot of conflicting advice, a lot of overwhelming advice. So it's no wonder if your hope has eroded. It makes sense if you started to believe that you simply can't get better and that nothing will ever work. But that belief, while it's completely understandable, with all due respect, is based on incomplete and outdated information. Okay. And that's not your fault. It's not that you're too far gone, that you can't get better, that this is just your new normal. It's that these approaches have simply been missing one key factor. Remember that shifting the sensitivity the sensitivity can shift in both directions. So the real question is, how do we shift the sensitivity back down? What actually does normalize those neurologic adaptations? Well, in this case, the physical approaches, the cognitive tools, the stress regulation practices, while they can all be supportive, in this case, they're not the primary focus. Sorry, I'm getting too excited and animated, and I'm knocking my water bottle over. Okay, again, I just want to say this, go back to this slide. It's not that these techniques are ineffective, it's not that they're bad, but the primary focus needs to be on normalizing the neurologic adaptations themselves. Now, unfortunately, that can't be done with one isolated technique. I wish it were that simple. What I have found is that what I've found actually most effective and what research supports, it involves I can't say it. Strategically integrating multiple evidence-based techniques. Let me try that again. It involves strategically integrating multiple evidence-based techniques and doing that in the right order, at the right time, customized to each person's situation. Now, if it's all right with you, I'd like to share with you what methods I integrate and what's working for the people that with complex and persistent pain that I work with. Would that be all right with you? Okay. So thank you. So these are the methods that I have found most effective, and these are the same methods that I'd recommend for you to integrate into your approach. So first is PNE, pain neuroscience education. Maybe you've heard of this before, because it's important to understand the neurologic factors driving your symptoms because it brings clarity, it brings certainty, and I'll say this isn't just educational. PNE is considered an evidence-based treatment in itself. It has been shown to lower pain levels and improve function, all on its own. Okay, but it's even more effective when we pair it with other methods, with the other methods that I'm about to share with you. Graded motor imagery is one of those other methods. Now, GMI is actually a series of techniques. I hate the name of GMI. Somebody named it this at one point. Even the people who named it regret naming it this. So be it. It's what we've got. We can't go back. But GMI is actually a series of techniques. It's more like a protocol than it is a technique that includes things like this. So laterality training, explicit motor imagery, mirror therapy. So, and these techniques, despite how simple some of them may seem, they can be very powerful. Okay, very powerful. They address some of those neurologic adaptations that we talked about, especially the ones improving the sensory processing. So, making the sensory processing more precise and weakening those automatic pattern pain responses. Okay. Now, we also have certain nerve drills that are based on neurodynamics. And these are specific movements designed to target nerves. So we're not targeting muscles or joints like typical stretches and exercises. And when these are done correctly, with the right strategy, they reduce peripheral nerve sensitivity and they help to restore or normalize nerve signaling. Now, these are not intended to be painful. I'll say that again. These are not supposed to be painful. They are often done with the wrong strategy, and they can provoke symptoms if they're not done correctly. When we do them, we need to adapt to them, to the person, to the location of the pain and of the symptoms, and to the intensity of the pain for each person so that it's not provoking symptoms to worsen. So I just want to say that. A lot of times I talk to folks and I hear them say, oh, I've done this, and turns out they've been doing them with the wrong strategy. Anyway, next on the list is my personal favorite. These are sensory discrimination strategies. So there's a whole category. This is a whole category of techniques. These involve using non-painful tactile sensory inputs, tactile and sensory inputs, to improve the clarity and communication between the brain and body. Okay. And I don't know if you've heard of desensitization. Unlike desensitization, which can be incredibly painful, these drills, these strategies are not intended to increase your pain or your symptoms. Again, that's never our goal. That's a theme here, is we don't want to increase your symptoms because we don't want to reinforce those pain patterns. Okay. It's also important, the next one on the list, is to learn the skill or the art of pacing, which is about finding that sweet spot between overdoing it and pushing through pain and underdoing it and avoiding too much. Okay, it's important to stay in that optimal zone for recovery as much as possible, which is extremely, I can't stress this enough, this is extremely effective at reducing pain because it builds a tolerance for activity, but it also reduces those pain, the pathway sensitivity. It actually helps in all 4 of those neurologic adaptations. So very powerful, not easy to implement, but very powerful. Next, we don't just want to ditch those physical approaches altogether. We just want to tweak our approach slightly. We want to introduce them at the right time with the right strategy. Okay, it's important to layer in the strengthening and the stretching components when your body is ready for it, when you have certain indications that your body is ready for it in the right amount, and without the classic no pain, no gain approach. We want, again, I say this over and over again, we don't want to make your symptoms worse. So we need to adapt the old-fashioned way of thinking a little bit. Now, next on the list, we all know that pain levels can spike randomly and symptoms can flare up. So it's important that we have a plan for what to do the moment that pain flare starts so that you can recover as quickly as possible instead of just waiting it out, kind of hoping for the best. Okay. But so we want to have a plan, but we don't just want to dump water on the fire without ever turning off the gas. We have to do both. We want to be able to put water on the fire, but we need to turn off the gas. And so it's also important to learn to predict and prevent those pain flares the moment they start, well, in the first place. So preventing them is a big important piece, but at the very least, if we can't prevent every single flare, then maybe we can lessen the blow, and not make it be such a dramatic, thing. Okay. Lastly, and finally, there are some helpful lifestyle and mindset factors that are important as well. Now, these are supportive. Let me just say this. These are supportive. These are not a standalone fix by themselves, but there are tools that we can use to enhance the deeper work that we're doing with these other strategies. So this includes some simple things like having healthy sleep practices that work within the constraints of having chronic pain and that are not too rigid, not too rigid, not such rigid rules, because chronic pain is difficult and different and complex. And it also includes some simple breathing practices, some simple breathing techniques to help boost recovery capacity. Again, we don't use breathing as a standalone cure. I don't think of it as a cure at all, but it's a tool that supports the other techniques that we're doing and enhances them. Now, I share all of this with you, and to some of you, it might sound overly simple. To others, it might sound like a lot, maybe overwhelming even. And either way, there's this tendency to want to do it all at once. There's this urge to just get it all done all at once. which would actually be a very big mistake. And lots of people make this mistake. So I want to caution you right up front, because when you try to introduce everything all at once, there's not only a risk that the pain system will react negatively, but also when we introduce everything all at once, we won't know what's helping and we won't know what needs to be tweaked. So instead, it's important to introduce each technique in phases, allowing time and space for adaptation to happen. Now, over the years, I've pulled together the research. I've implemented these strategies, these techniques in the real world. I've seen what works and what doesn't. And so after years of testing and refinement, I've structured this into a 5-phase approach that allows the nervous system to adapt at each stage. So quickly, I'll go through this. Phase 1, super basic, like kind of the introductory of what we're doing today, is understanding those neurologic adaptations that are driving your symptoms, right? So that we know what's going on and what to target. Okay. Phase 2 is setting the foundation for recovery to happen. So we're creating those conditions where your system can actually change and improve. Phase 3 is expanding the activity tolerance. So learning how to do more without triggering those protective responses. Phase 4 is it involves normalizing those hypersensitive pain pathways. This is where we layer together all of these different techniques, these very strategic strategies, and layer them together. Okay. And then in phase 5, rebuilding, it's rebuilding physical strength safely. So once the sensitivity is reduced, right, we lower the sensitivity of the pain system. We reintroduce the stretching, the strengthening components with the right approach so that when your body is ready. Okay. So this is the exact process. These are the exact steps and the techniques that I take my clients through in my program, which is, again, the chronic, you can't read it. Is it minimized for everybody else? Do you just see my big face? I hope you can see my slides. Can everybody see my slides? Okay, Michelle, it might be, I don't know, something on your device. Okay, I'm gonna keep going. Hopefully we figure that out. So let me just say this. Some of you may be thinking, okay, Alissa, just tell me exactly what to do and I'll do it. Okay. And I get it. Okay. I'm not here to play games. Or I should say, you're not here to play games. You want the steps. And also, I'm not here to play games either. Okay. I'm not here to withhold information. I'm not withholding proprietary information. I've already told you, I've laid it all out here for you. All the tools on all the techniques that I would use, even the order that I would use them in. But this is not just what tools you use, it's how you use them. The strategy matters, the sequencing matters. Applying each technique correctly and consistently matters. Okay, we can't expect earth-shattering results after trying something once or twice, right? Accountability matters and ownership matters. So building the skills and understanding to manage this long term rather than just relying on ongoing appointments and passive interventions with reactive care. Okay. Here's the thing. I would love to give you all the step-by-step instructions here today, but one size fits all protocols don't work because there's nuance at every single step. And importantly, what helps one person can actually harm another and can cause detrimental effects. And so that's why the approach needs to be adaptable, not generic. Okay, you need a clear framework that allows you to individualize the approach for your situation. So giving generic advice on a workshop like this without that framework, without, teaching you how to adapt it, would be professionally irresponsible of me. And if that's what you're looking for from today, then I'm probably not the right person for you. And so out of professional integrity, I won't share anything with you that could make your situation worse or could cause you to lose more hope. I'm simply not willing to do that. And so I'm not saying all of this to scare you or deter you or anything, but what I can tell you is that when this is done right, it works. Okay. I have seen people who've struggled with pain for many years, 5, 10, 20 plus years. and finally get their lives back. I've seen people cancel surgeries that they thought were inevitable, that were required. I've seen people get off medications that they'd been on for years. I've seen people who could barely walk around the block get to a point where they're now hiking and traveling, playing with their kids again. Not because they tried harder or because they thought harder or differently, but because they found that one thing that fixed everything, but because they finally had a systematic approach that addressed what was underlying their pain. One of the bigger elements that was driving their pain. And I would love to help you figure out what that could look like for you. Okay. Now, if it's okay with you, I'd like to take just a couple of minutes to share how I work with clients to implement this approach. Now, of course, this won't be for everyone, but if you are interested in hearing how I might be able to help you, then you can stick around for just a few more minutes. And then if it feels like a fit, we can talk about what your next steps might be. Okay, sound good? And then I will also give you that pain flare toolkit that I promised at the beginning. Sound good? Sure. Okay. Thank you. Awesome. There we are. We're getting some yeses. Now, my program, if you haven't already caught on, is called the Chronic Pain Breakup Method. You'll have to forgive me for the very tacky name. I named it several years ago, and that's just what stuck. The program, it walks you through those 5 phases that I just briefly shared with you a moment ago. It's guided, it's structured, it's step by step. Now, there's essentially 2 main components to it. Okay, there's the live, like coaching and support component, and then there's the training modules component. So the training modules includes comprehensive training modules that teach you each technique, how to adapt it for your situation, and how to know when you're ready to move to the next phase. Most people, as it says here, most people move through the process in 16 to 20 weeks. And then depending on what works best for you, you can get support through direct coaching with me, either as needed on an as needed basis or as part of a more comprehensive experience with weekly calls and direct messaging support and a group element as well. And so I don't want to spend too much more of your time going on and on about my program. So rather than going through all the nitty-gritty details here, I thought it would be more helpful if we just had the opportunity to have a nice little one-on-one chat on the phone. Because again, I don't know your specific situation. I don't know what you've tried. I like what has worked, what hasn't worked for you. I don't know where you are on that sensitivity spectrum. And I don't know if this is the approach that would work for you, would work best for you. So I'd like to invite you to schedule a call with me. Amy, I anticipated that question. Let me save that till the end. So I'd like to, like I said, I'd like to invite you to schedule a call with me. This call is about, I'm just dropping the link in the chat here so you can open that up. The call is about having an open and honest conversation about your pain, about your recovery, and exploring your options and getting guidance and support. And so if that's something you're interested in, I just dropped the link there in the chat. Just click that link, look at the calendar, find a time that works for you, and then we'll talk. And for the record, these are 45-minute calls. Okay, so we have plenty of time to cover the important parts of your background, probably more time than you would ever spend at your doctor's office, to be honest, at most doctor's office. So we have plenty of time to go over your background, to go over your symptoms, to discuss questions that you might have. And unlike many of my colleagues, I don't charge for these sessions. These calls are free. I don't use a sales team. I don't believe in using a sales team. You'll actually be chatting with me personally on these calls. So yeah, you're going to talk to me. I don't take payments over the phone at all. So there's literally nothing to buy or nothing to commit to on this call. Okay. I do not believe in high pressure tactics. I believe in transparency and giving you the information that you need to make a decision. So if it's a good fit, then great. If not, no hard feelings. At the very least, you'll walk away with clarity on what's going on and what you might be able to do about it. So please click the link, find a time that works for you, and we'll chat. Okay? Amazing. Okay. We can go through some questions really quick. I had a couple. Let's see. Where was the one? Can stem cells help with all this? So I would probably put stem cells in, we're going back, way back. I would probably put stem cells in the physical approaches bucket. Because so stem cells, this is just my opinion, and what I understand about it, stem cells can help regenerate a structure if there is something that is torn, damaged, that needs um, healing, physical healing. So again, if there is a structure that is injured or damaged, whether it's like cartilage or whatever, like if there is something mechanically, structurally that's contributing to your symptoms, then stem cells may help, but may not be the best fit. The reason that I'm skeptical of stem cells, it just depends on the region where, like the structure that it's being used to treat. Like, so for example, if you use it to treat like a tendonitis or a tendinopathy in an area where there's like poor circulation and there's obvious like structural tendon issues, then it might be able to help in those cases. But like if we just inject it, say, into a shoulder joint, for example, how do the stem cells know what to repair? Anyway, I could go on and on about this. Um, I see mixed results with stem cells, just generally speaking. Um, so I'll say this. Could it help some people with the right physical issues, like tissue level issues? Sure. But if there's that additional component where there's also neurologic aspects going into this, then the results from that may be limited. I'll say that. Does that make sense? Who was that? Heather? Does that make sense? Oh, Dana. Okay, wait, there's too many questions. Oh, yeah, an annular tear and it did nothing. So, okay, so I have a whole lesson on this in my program. But okay, so annular tears at the disc level, they actually what ends up happening is they cause a substance to leak out of the disc. And where does that substance go? It goes near the nearby nerves. And it only does this for a short period of time. It's not like constantly leaking this substance, but the substance is an inflammatory substance, and it can cause nerve sensitivity. And that nerve sensitivity sticks. Unfortunately, when we go into your MRI and we see these annular tears, um, that's the that's the explanation that we go to. We go, okay, it must be that. So let's treat that. And often what's going on is like a downstream effect of that, a long lasting effect of that, where the nerves have changed to become sensitive. So that would be the nerve, like number one, nerves become hypersensitive. Um, often in cases. So it's not purely, oftentimes when there's disc issues, it's not purely just a structural mechanical disc issue. There's other like nervy stuff going on too. Um, I'm just going to go backwards through the chat. Okay. So hopefully that answers your thoughts there, Andrea. And Heather says, thank you. You're welcome. Dana, Andrea, if you want to, you can send a copy of your MRI if you think it would be helpful to look at. People have done that before. So Dana says, I'm assuming the meeting I had scheduled already for Thursday is the meeting you are referring to. Yes. Yes. So let's keep that. If you already have a call booked, great. Let's chat. That sounds good. Let me go back up. Amy, why have doctors not figured this out? You know, as I was saying earlier, the presentation that I redid this whole presentation like yesterday. And the previous presentation, I had a whole section on this because that's a big question that people have. Why have doctors not figured this out? And I think that question comes from, well, if doctors haven't figured this out, then it must not be legit. Um, which isn't true. Like this is so evidence-based. There is a lot of research. I'll say this, the medical system and our medical school curriculums are probably 15 to 20 years plus behind the research. So the newest research hasn't quite made its way into the medical curriculums for medical schools. That was my thought for a while. Yeah. There is a plethora of research. There are studies that go back over 20 years ago talking about this stuff. Like, I mean, even past 20 years ago. Like, anyway, this has been around for a long time. We are learning a lot, and it's not made its way into medical curriculum. I'll just say that. Doctors who have heard of it, actually, there's only, I believe, one or two. I know Johns Hopkins um, med school has some training on this, but most of the time, if they do have any training on this, doctors learn maybe one lecture or one slide in a lecture, one bullet point in a lecture. And so if they have heard about this, their knowledge of it is limited. And if they have heard of it and they try to communicate it to patients, it often sounds very demeaning, very blaming, very gaslighting, very much like, hey, this is all in your head. And then they will often just say, hey, yeah, you have this, by the way, and your nervous system is sensitive, and we don't know what to do about it. Um, and so I think it's just a huge flaw in the way that the medical system is built and set up and how doctors are trained. In addition to that, if you follow the money, yes, Sabrina, more money to treat symptoms instead of curing. You're exactly right. Over the years, I have started to believe that our system is not set up to actually help us long term. It's just to pacify us and get us by. In fact, as I said, I've started multiple pain programs over the years, and I was the director of rehab services, but the director of the entire program was like a pain management doc, and he told me, also like, your job is just to be a glorified massage therapist. Your job is just to pacify them enough to get them between their visits. Um, and I just don't see it that way. I see it as, you know what, we should be treating what's actually contributing underneath. Um, and yeah, what pays the best? Where follow the money. Like injections make the most money, pharmaceuticals, surgeries. They're the fastest quick fixes there are. And so medical system likes those things. And so they're going to pay for those things. And I don't think that they have the best long-term effects for people who fall into this bucket. Um, are there any other questions? Doop-a-doop-a-doo. Okay. Best options for medications for pain. It depends, my friend. Adele, I would love to have that conversation with you over the phone. Vance, they keep trying to sell me an implant. Yes. Yet an implant caused CRPS. Yeah. This is where a lot of I think the medical system is very limited because you see the same, like, it's like they're on the same script, they're on the same plan. Like we do these medications, we do these injections, and then we do the stimulators. And that's often like we do ketamine and we do the implants, the spinal cord stimulators. And I'm not a fan, but y'all know that already. Um, is the information available forever or for a limited time? Michelle, you're talking about in the program? Like if do you get unlimited access to the content? If that's your question. Okay, yes. So it depends. I have to say, I'll explain this because this is my logic. So it depends on which route you go. If you go independent study, um, okay, let me start here. If you go with the all-inclusive experience, you have unlimited access to everything. You own it forever. Um, and with that, and I do that because there's already accountability because we're interacting the entire time. Okay. If you do the independent study, um, there is a timeline on access to content purely for accountability. When I first set up the independent study program, I gave people forever with the content. And what ends up happening is people who, when we have forever to do something, it takes us forever to do something. I've learned this. I don't want this to take you 3 years to get through. I want you to get results. I want you to get them as soon as possible. So as a form of accountability, I put a timeline on the training modules um, to put a little bit of a fire under your butt to get it done. Now, that being said, if you are, everybody moves at a different pace. You'd have access to the content for 20 weeks, but if you are just moving a little bit slower, you're staying consistent, but you're moving a little bit slower, email me, I'll extend your time. And also, if you finish the program and you email me and be like, hey, I want ongoing access, I will give it to you because I don't care about you having ongoing access. What I want is for you to finish and I want for you to get better. So hopefully that makes sense, Michelle. It's a very long-winded way to answer your question. Um, Sabrina says, I have an implant. If not for it, I would have committed suicide. So it has helped, but not to a point where you're where you want to be, I would assume. That's good news. I am happy to hear that, Sabrina. I've heard stories of all kinds. Like it's helped to some extent, it's not helped at all, it's made things worse. Everybody's so different. And in my opinion, it's not like it's completely like if you haven't done a spinal cord stimulator yet, it's not like it's off the table completely, but like if there's something else that we can do before we take that step, because it's such a permanent step, like, why don't we explore all the other options first? It's still there on the table, but we can revisit it later. So those are just my thoughts. I think those are all the questions. I just want to say thank you all for coming today. As I said before, my mission and all of this, my purpose here and on this planet is to give you the tools that you need to make a big difference in your quality of life, in your care. And so, amazing. Thank you. If you booked a call, I look forward to talking with you. Um, Again, the call is about me being of service to you. So, I look forward to chatting with you. Either way, you'll get so much out of our conversation. Thank you, Michelle. Thank you, Vincent. Thank you, and Andrea, Dana. Thank you, Christine. I'm really looking forward to talking with you all. Thank you again, everyone. We'll talk soon. Bye.